My name's Mark Miller. I'm a doctor working in the emergency department, and I'm here to explain why it's important for everyone to know how to respond to a cardiac arrest. In Australia each year, about 30,000 people suffer a sudden cardiac arrest, and this includes young people who didn't even know they had heart disease. And unfortunately, only around 10% of cardiac arrest victims survive. Part of the reason is that most don't get early chest compressions and early defibrillation. Well, there are many places in the world where survival is much better for cardiac arrest. In some cities, 60% of people survive because of an effective bystander response, delivering early chest compressions and a shock from an AED. Early chest compressions and defibrillation are critical to survival, but we can't rely upon doctors, nurses and paramedics to provide care to every cardiac arrest victim before they get to hospital. We're here to teach you some basic skills so you can help save a life. All of you can make a difference with very little training and a bit of confidence. If a cardiac arrest victim gets early CPR and defibrillation before the paramedics arrive, their survival rate is dramatically increased. Bystander efforts have a much bigger impact on survival than any other treatment we can provide in hospital. So what is a cardiac arrest? Well, most cardiac arrests are due to heart disease, and many follow a heart attack. A blood clot forms in diseased arteries supplying the heart muscle, and this causes the heart to go into an abnormal electrical rhythm. The heart twitches, it can't pump blood, and you die within a few minutes if no action is taken. This is a cardiac arrest. Without chest compressions, within a few minutes, the abnormal rhythm becomes a flat line and the patient can't be saved. By doing CPR, you keep the brain alive and the heart in a rhythm that can be fixed by an electric shock with an AED. What would you do if someone collapsed in front of you, or if you found someone collapsed? How would you recognise a cardiac arrest? First, make sure it's safe to approach. There's no live electricity and no risk from traffic. You shake and shout, "Are you okay?" If there's no response, call 000. The ambulance dispatcher will stay on the line and guide you through cardiac arrest recognition and chest compressions. Put them on hands free. After cardiac arrest, the victim may stop breathing, but early in cardiac arrest, the patient may continue to breathe, and this can be confusing. It's not normal breathing, it's more like sighing or gasping. Now it's time to start hands-only CPR until someone arrives with a defibrillator. We're not recommending a pulse check, airway opening or rescue breaths. Good quality chest compressions are key to the patient's survival. You're squeezing the heart and the chest cavity to create blood flow and send oxygen to the heart and brain. Put the heel of one hand in the centre of the chest at about nipple level. Lock your other hand into the first, keeping your arms straight and using your body weight. Push the chest down 1/3 of its depth. That's about 5 centimetres in adults. Allow it to bounce back. Depth and recoil are important to pump the blood. You press at 100 beats per minute to the tune of Bee Gees' Staying Alive or Baby Shark. It's hard work, so seek assistance and don't stop between operators. You're unlikely to harm the patient with chest compressions, so don't be frightened by that. After all, they're in cardiac arrest and their day can't get much worse. Push hard and fast and don't stop. So why no mouth to mouth? Around the world, instructors are teaching just chest compressions now. Studies show that CPR with rescue breathing is no better than just chest compressions, and the thought of mouth to mouth stops many people starting CPR. If you're trained and comfortable with rescue breaths, that's fine. We're encouraging rescue breaths in children and drowning victims only. In children, we still recommend doing rescue breathing, as the causes of cardiac arrest in children are very different to those in adults. And that's 2 rescue breaths to every 15 compressions. Early defibrillation is the next critical step in saving a life. Automatic external defibrillators, also known as AEDs, are becoming more common in the community, and they're easy to use. They come in different shapes and sizes, but all are simple to use and safe. You turn the AED on, you connect the pads to the patient, and you follow the voice instructions. The AED will tell you exactly what to do. It'll tell you when to deliver a shock if it's needed, and it will tell you when to stop and start chest compressions. So the key steps are easy to remember. Call, push, shock. Identify the cardiac arrest with a shake and shout. Call 000 and stay on the line. If there's no breathing or there's abnormal breathing, start chest compressions hard and fast, and don't stop until the defibrillator arrives. Remember, the bystanders play the most important role in managing a cardiac arrest. With good early chest compressions and the use of an AED, the chances of survival are much higher than if you wait for paramedics to arrive. Most cardiac arrests occur in the home, so you could save the life of someone you know and love.
He's not breathing. I think he's had a cardiac arrest. Guys, I'm just going to start CPR, okay?
Ambulance emergency, what town or suburb?
Newcastle University.
Tell me exactly what happened.
He's not breathing, not responding. We think he's in cardiac arrest.
Okay, I've organised some help for you now. I want you to stay on the line and I'll tell you exactly what to do next.
1, 2, 3, 4.
1, 2, 3, 4.
1, 2, 3.
Is there a defibrillator available?
Can we go and get a defib, please?
Do you have an AED?
Yes, we do. Is everything okay?
Yep, the ambulance is on its way.
3, 4.
I've got the AED.
The machine will tell you what to do. You need to follow its instructions.
Shocking. 1, 2, 3.
Okay, I can feel a pulse there, guys.